Healthcare is changing. The role of data and predictive analytics are at the center of a transformation of healthcare. And today, on episode number 110 of CXOTalk, it is my privilege to welcome Richie Etwaru, a Chief Digital Officer, and my glorious co-host, Vala Afshar, is here as well. Vala, how are you?
Michael, I'm doing great. I'm doing great. I'm so happy that you didn't have to look up my name.
Vala, take it away.
Richie, it's awesome having you on our show. First of all, I'm a big fan of yours on Twitter, so love to have a social Chief Digital Officer. And you certainly are accessible, open, and collaborative. So we've known each other in the social sphere. Now we get to have I get to have the privilege to learn from you. So why don't we start with you telling us a little bit about your background and yourself.
Hey, listen, guys, it is such a pleasure to be here. I'm a big fan. I said to Michael earlier, I've actually watched every single show.
Oh, come on!
No, I have. I have watched
109 episodes.
I was one of the first people to watch the Guy Kawasaki show. And then I'm friends with Ray, and so I watched Ray's version, which was like your number 7 or your number 9.
Sure.
And I've watched them all since. I think the last one I watched was from the guy from Pegasystems. So I'm probably back 2. So there's 2 more that I haven't caught up on. But I'm a big fan of the show.
Thank you, sir.
Thank you for watching. Tell us about your professional background and tell us about IMS Health.
Yeah, so I'm a geek by design. I'm a nerd. I'm a cool hunter. I just happen to have a decent UI that people will stand. Grew up as a programmer, born in South America in a British colony. Did everything on the IT side of the world. Started 2 companies, sold them. Got bored, came back to the corporate environment, went on the business side, and then just decided that I was going to, change companies. And I was, head of innovation at UBS. Came over to healthcare. I wanted to study another industry. One wasn't interesting enough for me. And here at IMS, where, as you described in the beginning, healthcare is going through a massive transformation. Predictive analytics is probably a drop in the bucket of the things that are going on in healthcare, and we can talk a little bit about that. But IMS is sort of a lifeblood company, right? So if you think about industries and how they exist, Bloomberg is sort of the lifeblood of the financial services industry. For good, bad, or indifferent, what comes from an industry, right? IMS is sort of one of those lifeblood-like design companies that facilitates healthcare. So we provide all of the data that healthcare runs on, everything from scripts to doctor information to real-world evidence to patient data, EMR records, that type of stuff. We provide technology to help life sciences company take brands or drugs to market. We interface with pharmacies, hospitals, and we got a set of services to go around it. So really, really interesting space to be in, really interesting size company. We're not that big behemoth. We're about $4 billion. So quite still agile, but not small enough to not have the resources to do things. And we have a really good trusting relationship with our customers, and we're just ready to rock and roll.
That's fantastic. Richie, before we get into your role, Chief Digital Officer, one of the fastest growing C-suite in the enterprise, you're also an author of a new book. You'll see the book over my, my left shoulder, Corporate Awesome Sauce, Success Rules for Generation Y. And tell us a little bit about the book. And I love the title, I love the packaging, and I suspect some of the rules in this book or guidance in this book is what actually positions executives to be able to adapt and really deal with this digital transformation that will impact every business of all sizes.
Yeah, so here's the thing, right? I got lucky in my career, right? I've had a very zigzag career. I've gotten some really, really lucky breaks early. And I think most people that have gotten far would be lying if they tell you luck didn't have a little bit to do with it. But somewhere about 5 years ago, people just started asking me all the time. I was at UBS, and I used to go out to colleges and recruit new hires, right? So we recruited the best and the brightest at UBS. And folks would ask all the time, how did you do it? What did you do? You know, how'd you get there? And you know, I would give really silly advice like follow your passions and get mentors and you know and take only calculated risks. And I was lying. I mean, those rules really don't apply in today's corporate environment because the pace of change is changing. And so we're seeing an acceleration of change, and leadership itself has been redefined. I mean, yeah, you can go back to like, you know, Machiavellian descriptions of leadership and assume that you can still run that today. The fact is, most of what I've done is anchored in counterintuition. You know, instead of trying to get jobs, I tried to get fired. And in trying to get fired, it allows me to take the types of risks that I would not have usually taken if I was worried about a paycheck. Instead of getting mentors, I like to mentor people because I learn more from the mentoring process than being mentored. So the book is really, there was a point in the last 5 years where I got frustrated of just lying to folks all the time that this is what I did, and I got called out a few times like, no, I've worked with you. You actually don't do any of that crap that you're talking about. And so I wrote a few things down and I started to run it by a few friends, and they're like, man, yeah, this is exactly what you do. And you know, started fleshing it out, and people just really responded to it and resonated with it. And at some point, you know, I actually pitched it to a few traditional publishers and got some buy-in, and they ran me some covers and some titles. You know, the cover was like the boring guy with a briefcase on a ladder, and I figured I'd go indie and name it myself and brand it myself.
Pretty neat. Let's so link this now to the Chief Digital Officer role. So it's a fast-growing role, a relatively new one. So at IMS Health, as the CDO, tell us what you do.
Yeah. So you know what? I'll create a perfect link for you. This is the book of what CDOs should do. If you don't know this book, this is Ray Wang's Disrupting Digital Businesses. This is the book that helps you figure out how to actually do it.
So
right?
tell us about, so Richie, tell us about your role as a CDO at IMS Health. Tell us about the things that you actually do.
So it comes in three flavors, right? So I describe the CDO as keeping companies from having their Kodak moments, right? So IMS itself is going through a transformation. So a lot of that has to do with how we look at our P&L, what was some of the traditional things that we sold and what we should be selling now that there are digital economies in place. So that's the first part of it. The second part of it is our customers are going through transformations as well. And so from an advisory/services capability, I'm working with customers like Johnson & Johnson, Pfizer, et cetera, to figure out how they avoid their own Kodak moments, many times within an individual brand. And the third part of that is to really act as an evangelist in the P&L to make sure that we're not, you know, mistakenly leaving opportunities on the ground within the new economies that are being created by digital opportunities.
And when you say Kodak moment, maybe tell us what you mean by that.
Well, so Kodak was the slogan for Kodak, and Kodak actually, you know, could have figured out digital photography if they wanted, but they were, you know, too worried about the revenues that would come from the film business. And in many ways, Kodak had their Kodak moment, and so has Blockbuster, and so has Barnes & Noble. And so I refer to it as the Kodak moment. It's that point where you realize that your P&L has completely evaporated because someone has replaced your products or services with something that's coming up from an entirely new set of forces in the marketplace.
And do you think that, so there are other technology savvy executives in companies, traditionally CIOs, why is it that Gartner believes that, you know, 1/4 of the enterprise will have a CDO? Is it because chief information officers are not guiding companies to avoid their Kodak moment? Or is there some special training, special priorities, or a special mindset that a chief digital officer brings to the table that your traditional IT can't seem to deliver?
Well, I think Gartner is saying it because it's clickbait and it sells research reports.
Okay.
But I think, look, the CIO, and I've been a CIO, right? A lot of times you're struggling to become a value-creating center, but for the most part, you're a cost center. The CTO, and I've been a CTO as well, a lot of times you're out in the front of trying to figure out new economics above and below the P&L, but you don't really have business viability. I think the fundamental difference of a chief digital officer is that 49% of what you do is a general manager, right? You're looking at bringing products and services to the new marketplace and building profitability, and you have product management responsibility, et cetera, et cetera. Of the remaining 51%, I think 26% of that is somewhere around CIO, CTO, et cetera. And then the remaining 25 is just outright innovating, right? You have to outthink, outsmart, out-innovate, outplay, and outmaneuver the competition to the new marketplaces before they can even figure it out.
So Richie, you mentioned that you are helping IMS Health's customers avoid these Kodak moments, or another way of saying it is examine their business models to ensure that they work in the digital age. And I find it interesting that you're helping your customers with their business models. How does that happen? So it's an outward-facing role, at least to some degree, as opposed to just an inward-facing role regarding your company's IMS Health's business model.
Yeah, no, it's certainly dual-sided, and I love it that way for the mere fact that this role is still new, and we're all sort of figuring out. I don't think there are any CDO experts as yet. Maybe there's one at Gartner, but we're still figuring it out, right? So we're sort of co-creating it together, which is exactly what happened with CIOs, right, 20 years ago. You know, the marketplace is changing for our customers, and as a result, we have to understand how our customers are experiencing that change so that we can build products and services to help them through that change. So it's sort of a symbiotic relationship. Does that make sense?
Yes, of course. Sure.
Now, does this, when we talk about digital transformation, surely this goes beyond marketing. Can you talk about the scope of what does that mean as the CDO as you're trying to digitize your business? What line of business do you work with most? How do you prioritize the effort? You know, what type of input, output do you study in order to determine where to start with a $4 billion company?
So I think in order to answer this question, let's think of coolness as an asset that can move through an organization. I think a part of what I do is I make companies cool. I think that's part of a chief digital officer's job, at least within how the role is set up today. Okay, and so the marketing team can either be a supplier of coolness or a consumer of coolness. And my relationship with the marketing team is they're a consumer of coolness that comes from this role. And so marketing is more or less an amplifier. I think there was a little bit of a muddying of the waters early on about whether a chief digital officer is a CMO/CIO type stuff. I think, and no offense, Vala, I think CMOs do what they're supposed to do, and it's very important. But I think somebody got us into some silly conversations about whether a chief digital officer is part CMO. From my perspective, absolutely not. The bane of my existence is to make sure that we don't go out of business. And so, you know, and not that we're close to, but we all have to be more ardent about the possibility as change increases and the barriers to entry lowers. I mean, we're seeing the type of industry, and I love the way John Hagel from Deloitte's Edge describes this, right? We're seeing the attackers be attacked by attackers before the incumbents are even overthrown, right? So my role as a chief digital officer is to supply these assets, coolness, innovativeness, you know, forward-thinking capability to a set of distributors. Some of those are product people, some of those are marketers, some of that is go-to-market, some of that is financial re-engineering of a P&L. So I don't necessarily see the chief marketing function or the marketing function as any more or less important to a transformation.
What about the role of a chief digital officer beyond marketing in terms of the actual operations of the business?
So yeah, you own that part of it, right? So you're essentially starting a new company that has a more digitally influenced products and services set that runs a P&L, and that's that part. What I mean by 51% GM, right? So a lot of the thinking that I do is, what are the new products that we can bring to the marketplace? What are the new offerings that we can bring to the marketplace? And a lot of those are driven because of the digitization of information and processes, and in some cases products, right? So the word digital is sort of interesting here because, you know, we're playing in a digitization of markets. I think that's why it's called a chief digital officer in my mind, at least.
So here's what's cool. Growing revenue is cool. Reducing expenses and optimizing and create a lean environment is cool. Satisfying customers, whether they're your internal or external customers, is cool. Meeting regulatory compliance requirements in order to stay in business is cool. So is all of that what you're trying to do that you're calling cool, or is it that mobile, social, cloud, app, Internet of Things? Is it the technology that's cool? It's really the business outcomes that you're trying to get to that makes it cool, right?
Yeah, look, I operate in the mobile, social, wearable, cloud world, insight world. But
Yeah.
no, this is a fundamental, from my perspective at least, this is a fundamental study of economics. It's a fundamental study of supply and demand, and it's the core or the primary goal of a chief digital officer is to think about the next generation P&L, where more of the revenues will be coming from new market opportunities as opposed to market opportunities that would have funded value creation historically.
Got it.
But let me ask you. But let me play devil's advocate. Vala, go ahead. I'm sorry.
So let me. I just want to make sure I'm clear, because when I think of a company like Uber, you got a 6-year-old company that's currently valued at $50 billion. That makes them more valuable than 80% of the S&P 500.
Yep.
Now they're cool because they took mobile social app and delivered a better experience and completely disrupted a 100-year-old taxi business model. Is that what you mean? In other words, taking advantage of. Okay, go ahead. Okay.
So here's the thing, right? A lot of times the outcome is executed by social, mobile, cloud, wearables, sensoring of the world, IoT, etc. But the study of it requires a deep functional understanding of value creation, right? So let me give you an example. Our customers are providing molecules, right, chemistry as drugs for folks that are sick, right? You might go back to something like an apple a day keeps the doctor away, and you might ask yourself whether we can commoditize information delivered as psychological treatments to patients to actually change their behavior, right? So the doctor saying to me, hey, Vala, take your drugs, maybe it's not good enough. Maybe I want to think about how do I notify your spouse that you're not taking your drugs, or your care circle, or your kids, right? These are using information assets to drive an outcome, right? So that means that your kids, I don't know if you have kids or not, would be notified that Vala didn't take his pills today, Dad didn't take his pills today, right? Silly example, but so the manifestation of this type of deep thinking about the problems that we solve for might be social or mobile or highly digital. But the problem set that you study is still a value exchange between you and the consumer.
We have a comment from Frank Scavo, who's one of the top enterprise software technology analysts, who says he's not buying this line of reasoning, and I'm assuming because the notion of the CTO being the cool factor, I'm sure there's that element to it, but doesn't the CDO need to extend tentacles deep into the operations and help the company make look at its business models and make transitions along that way and help drive innovation that's related to operations and business models and customers and so forth? It goes way beyond being cool, doesn't it?
Yeah, no. So I don't. By no means do I think cool is the only currency. So that's a good tweet right there, right? Cool is not the only good currency. There's obviously other currencies. What I think is a distinction of the chief digital officer role is vertical versus horizontal, right? So a CIO is sort of horizontal, but mostly vertical still. A marketing individual may think themselves as horizontal, but slightly vertical as well. A CDO is really, really, really horizontal, right? So, I don't really have staff, right? I'm taking staff from various verticals to create these new opportunities. And so, yes, transformation has to happen, change has to happen, and you need to find the operating corridor to do that, but you have to be very horizontal to be able to make that happen. to simplify it, and I actually haven't landed on this. I just landed on it, so thanks for CXOTalk to give me sort of a new aha moment. But it's really like starting a new company to cannibalize the one that you have.
So, I mean, can you link transformation to innovation through your vertical efforts?
Yeah, I think we overuse the word transformation a little bit. I think innovation by itself is a movement from one place to another, and it's constant. People tend to think of pockets of innovation as we've done a transformation, like a full circle. I don't necessarily hone in on the word transformation that much, because it kind of leads people to believe that there's an end state or a target state where it's over. So from my leadership style or my vernacular or my lexicon doesn't really lend itself to that too much.
I just read in Wall Street Journal that 40% of Fortune 500 companies still do not have mobile adaptive websites. Now, if a company in the Fortune 500 that doesn't have, the 4 out of 10, decides to invest and build a mobile adaptive website, would that constitute a transformational change or no?
No, that's just going mobile for mobile's sake sometimes. Or if your customers needed it, you would have been there already, right? So does Caterpillar need a mobile website? Probably not. Should they have one? Yeah, maybe for those one-off use cases. So no, I don't see that as transformational. When UBS went to a mobile platform for banking, yeah, absolutely, that was transformational. When Chase rolled out deposit your check from your phone, yeah, that was transformational. Yeah. So mobility is not necessarily transformational. Every time it's transformational, contextualized to the product or service that you offer, right?
Makes sense. Yeah.
So let's explore for a moment this link between digital transformation and innovation. Can you say, from a CDO point of view, how do you link the two?
Yeah. Hey, can you repeat the question for me? I'll tell you why. I don't have my charger with me, and I just realized that I'm at 15%, and it completely screwed my train of thought. So we probably have about 15 minutes to go. Sorry about that, and I can't get up to go get my charger. That was probably a miscalculation on my side. It started 100%. So repeat the question.
Okay, so from the Chief Digital Officer perspective, this link between innovation and digital transformation, what is the connection there?
Yeah, you see, I think that is probably the most important question that we landed on within the context of the CDO, right? So can you transform digitally without being innovative? Right, Ganesh, who was on the show, and I don't think he used this example. Ganesh from GE, right? So they've got wind turbines that they sell, and they've sold them transactionally as products, right? And they were able to add a sensor to it so that they can provide services to monitor wind information and then adjust the torque of the spinning capability, whatever that is, so that the thing lasts more over time. Right, that's a service on top of our product. Is that digital transformation? Yeah, because you now have a digital revenue stream on top of a once analog revenue stream. Did it require innovation? Yes, absolutely. So I think my answer is yes, you have to be innovating all the time in order to find these digital revenue streams on top of these analog type streams that you've had in the past. Can you haphazardly land on some and not necessarily innovate? Yeah, probably. But innovation is a big part of what I do. Reflective thinking of the customer journey is a lot of what I do. I've got to be able to study what do we sell, why do people buy it, who are they buying from our competitors, what would they want to buy tomorrow, and then based on a set of inventions that are there, whether it's mobile, social, Internet of Things, wearables, whatever it is, how can we create the next generation product before our customers?
Got it.
Before our competitors, sorry.
So let's say you were the CDO of my company, and I come to you and I say, Richie, as the Chief Marketing Officer, I'm confused. I just read the super infographic from Scott Brinker, and there's 1,876 tech companies selling their products specifically to marketeers in 43 different categories. Richie, help me figure out how to prioritize which technology company we need to invest in. How would you help marketeers today that are essentially drowning in an ocean of tech being thrown at them to help improve their brand relevance and revenue growth and so on and so forth?
Yeah, you know, I think so. So the interesting thing is that, you know, Wanamaker, what was it, like 50 years ago? Wanamaker might have said, you know, half of my advertising money is spent. The trouble is, I don't know which half. Um,
That's right.
and so the thing here is, did we actually get better over time? Are we at like only 25%? We don't know which half, or have we gotten worse, right? And now we just don't know which 80% is wasted. I think we've gotten worse because there's so many more channels and there's so many more duplication that is happening, right? I think we still send about 41 pounds of paper a year to the average American household. I think it's like 5,000 spam emails to the average American adult, something like that. Talk about waste in marketing, right? So I think a lot of these vendors are thinking about how do you amplify, how do you distribute, how do you get to. I don't think there's a lot of folks that are thinking about how do you really calculate, not only how do you get the right message to the right person at the right time, but how do you not send the wrong message, right, to lower cost. So I would bifurcate right away and go, and again, sometimes this is sort of this chief digital mindset, right? It's what problem are you solving for? What are the tools that are out there? I see a lot of multi-channel marketing companies that help you get on all channels. My question is, so what, right? So technology can be digitally precise but tone deaf. And so I think, and I did this yesterday at the IMS client conference, my entire remarks were around defining the word insight. I think insight is just incredibly overused, and it's because people are getting they're getting shamed of using big data too much, so they're starting to use insight. It's context and precision, right? Context is the art of marketing. Precision is the science of marketing. Context comes from software. Precision comes from data. So we just have to stop wasting on marketing. I think that'll help you weed out half of the vendors.
Okay, let's. We've spoken a lot about the Chief Digital Officer role. Let's make the leap to healthcare, and tell us what and the business models of healthcare and the role of data and predictive analytics. So tell us about what's going on there.
Yeah, you know, this is probably the most exciting industry to be in. At least from my perspective. Healthcare has gone from what I like to call a design of questions to a design of evidence. And I think it all happened to us about 15 years ago with financial services. There was a point where you realized that you knew more about your portfolio than your broker. I don't know if you guys remember that point, but I think we all landed on it somehow. Healthcare is having that moment right now, right? We're starting to realize that in many cases, the consumer, which is the patient, or the doctor, depending on where you are in the supply chain, knows more than the supplier, right? And this is the democratization of information. All the Wikipedias and WebMDs of the world, we're getting to a point where the doctor is becoming the patient's first, second opinion, right? So they're self-diagnosing and then going to the doctor as a second opinion. Then they get out and they look for a third opinion on Twitter and read Vala's tweets, right, to try to switch drugs. That whole shift in the information ecosystem is driving a lot of change here. So healthcare companies need a lot more evidence. They need to know more. You're no longer providing answers to questions or matching questions to content, which is where financial services was, right? We didn't know anything about the stock market, so the broker basically just provided, answers to us. To where the consumer side of the industry has evidence, and so we really need to understand context very, very, very properly. So it's a deeper study of information. It's a more precise study of information. I think we're getting closer to understanding each customer to a segment of one. We're not there as yet, but for patients specifically, I think that's very important, and for doctors specifically.
So when you say that, tell us specifically. So what is actually happening when you say understanding patients as a segment of one and so forth? What's actually taking place, and what's the mechanism driving it?
Yeah. So there's three large forces. One is patients have more information, and so they can make better decisions about care. Right, and so the sanctity of the doctor's bubble is bursting. What does that mean? It means that whatever prescription you write, you're going to have low efficacy on it, or it will be swapped out by some sort of alternative medicine, whether that's a generic or some sort of preventative stuff or some sort of black magic from somewhere, right? That's the first part of it. The second part of it is from a regulatory standpoint, the entire economics of the industry is changing because of Obamacare and the payers, the accountable care organization model, where doctors are not necessarily they're practicing less as what we grew up knowing doctors are, and more as 9-to-5 workers, because they're looked at from an outcome and efficiency perspective. So that's the second. And the third is just the supply side, right? So the single molecule supply is falling off, and we got to figure out how to find new cures for different types of diseases. And there are not a lot of blockbuster diseases left. It's a lot more specialty type diseases. And so the launch of a big blockbuster drug that has a reach of 3 billion is probably going to be very scarce. Now we're looking at therapeutic classes that have patients that are 250,000. And how do you bring a drug like that to market? How do you make an investment case to capitalize the R&D needed to cure for some of these drugs that only affect 200,000 people, right? It's sometimes they're called orphan drugs, sometimes they're called specialty drugs. You think about those three things moving together at the same time, and then you add on social, mobile, big data, all that type of stuff on it. I mean, this couldn't be a more exciting time for a CDO/geek.
Yeah. So we have a question on Twitter from Frank Scavo, and he asks, how is IMS Health monetizing prescription data, and what does that mean?
Yeah, I think there are ways where we use the information, obviously within the right privacy constructs and within the right compliance constructs, to help pharma companies and other entities in life sciences better understand where patients are, so that we can deliver products to those areas. Sometimes it's geography, sometimes it's countries, sometimes it's just pockets of people that have economic instances that are economic realities where we can steer our customers to be able to bring better services. Copay cards, for example, is a really, really interesting service that we provide that allows us to inform our customers about where there are patients that simply can't afford drugs.
That's a good example.
So the role of data. Talk to us more about the role of data in digital transformation and specifically in healthcare. And especially IMS Health is a multi-billion aggregator of data, so I would think that this strikes particularly close to home for you.
Yeah, look, we've actually grown the data aggregation business quite a bit by pulling in new vocabularies, right? And I think real world evidence is a part of that. I think growing geography to be able to cover more of the world is a big part of that as well. But this is a precision business, right? If you do something wrong here, it's not like you lose your 401k. People die. And so information is at the core of getting life sciences correct. And so this is one of the reasons why we're so passionate about how we help our customers. The other side of a new information supply chain that is starting, which still needs to be understood, is what wearables and the centering of the world is doing, right? So, if we just pivot for a second and stop worrying about old world data and think about new world data, right? You think about the sensors that measures your heartbeat 24/7, 365. Well, unless you're a chronic patient, that's kind of silly to measure your heartbeat 24/7, 365, because you're probably driving hypochondria more than anything else. Because my heart's racing right now because my battery power is at 4%, right? So there is a fall off point where we're sort of capturing too much information that could drive hypochondria and create noise. So if we think about wearables and that new data set for healthcare that will drive digital health and will sort of evidence the human body, we got to think about the frequency by which we measure them, right? So and what that means is if I don't have to measure my heart, past once a month in order to get value out of it, if once a week doesn't really help me that much, and then once a day just creates hypochondria, are we actually going to wear these things? Probably not. Are they going to be embedded in our beds and our steering wheels? Yes. Will the pharmacy become the smallest hospital but the biggest wearable? Absolutely. Will ATMs become the smallest hospital and the biggest wearable? Yeah, because they have identity figured out and guaranteed delivery and privacy already. So these are the types of things that a chief digital officer sitting down and going, yeah, it's great that Silicon Valley can build the next smartwatch or Fitbit, but let's think about the problem differently.
We have a question, and I realize, Richie, at any point we could lose you.
5%, we're back up.
All right.
For some reason, it went from 4 to 5.
All right. Brian Fanzo on Twitter asks, curious with all the change and growing technology, how do you hire those with the proper, and he puts Swiss Army knife of skills? Talk about hiring into your organization or working for you. What do you look for in candidates as a CDO?
Yeah, I look for people that have done different things. I look for people that have done a lot of different functions. I think about people that have worked across different industries. This is not the type of job that has a vertical trajectory. On any given day, I am meeting with product, marketing, communications, operations, compliance, legal. It's a very, very horizontal-looking job. Someone asked me the last time I was on one of these interviews whether I thought that the CDO would be the tech-like C-level job that would probably more than likely make CEO easier than a CIO or a CTO. And absolutely yes, because you have a GM component to it and you're operating horizontally.
Great.
Do you use startups as a external source of innovation to supplement your own internal innovation efforts?
Absolutely, and we acquire as well, right? So we think about partnerships as, again, supply and demand. So perception, there are suppliers of perception, there's delivery of perception. I'm sorry, supply and delivery, right? There are products, there are process, there are platforms. So we look at innovation as well, inside and out. There's people that we supply from. We work with some folks. We made acquisitions. I think IMS acquired Aperture 2 years ago, a Seattle-based startup company. And we're probably going to get into some hackathons. It should be interesting to see whether we can do the type of work that Todd Parks is doing, the CTO of the U.S., with some of the healthcare data that the government has to be able to spin up some of these new market opportunities.
We have a question from Twitter again. When I look at my questions in Twitter, and the ones from Twitter are much smarter. So Zachary Jeans asks, will we see crowdfunding enter the drug/healthcare industry, and if so, how?
Yeah, and Zachary, hi.
Yeah.
Absolutely, right. So here's the thing. That when you think about this type of massive change inside of an industry, the word that sort of, to me, describes the outcome is a democratization, right? And if you think about Uber in many ways, or the entire collaborative economy, it's about democratization, right? So as barriers to entry lower and connectivity increases, right, because of the networking of the world, there's going to be a democratization of everything. Yeah. Should there be the equivalent of Kickstarter for drug discovery? Absolutely. The challenge here is that the cultures haven't blended as yet, right? So the scientists of the world are not necessarily tweeters. I can't tell you how many brilliant clinicians I've found that have never watched a TED Talk, right? Or brilliant clinicians that I've found that don't know that Kickstarter exists. So there's sort of like a cultural crossover that has to happen with healthcare to get some of the brighter minds to leverage some of the new economy type tools or thinking. But I think we're absolutely there, especially in these specialty markets where you might find, very, very wealthy individuals that want to pull together certain things. Lyme disease is a big one. I mean, there are some indicators that Lyme disease is one of the next global epidemics that could potentially be upon us. And the way we measure spirochetes today is still largely outdated.
Wow.
You mentioned measure. How do you go about measuring the results of what you do as a chief digital officer?
It's very difficult. It's probably one of the most difficult things I deal with every day. And so what I do is I also help on the business development side. And so on that second half of my job where I'm working with customers, at least I help to drive revenues, right? But core to the transformation side, like any chief innovation officer would tell you, it's very, very difficult. I think as we start to roll out some of these new products and services, we're going to be able to see some revenue impact, and we're going to be able to see some profitability on this sort of second company that's supposed to cannibalize the first one, or at least be adjacent to augment.
Sure.
So to me, it's too early, and it is probably one of the most difficult things that I deal with.
Okay, so we're entering the segment of the show where you're going to get hit with tough questions. And I'm going to keep going to Twitter because we have one of the top tech analysts in the world, Esteban Kolsky, asking a question. He starts with a comment, questions and scenarios that we're discussing are just evolution on current models. So what's truly disruptive or revolutionary today in healthcare from your CDO perspective?
First of all, I got to say hi to Esteban as well.
You knew the hard questions were going to come from Frank and Esteban, so.
Yeah. I think when we look at this stuff, and again, it is an issue of supply and demand, right? So real world evidence, I think, is probably, and RWE has many different things. It's real world data plus real world evidence. Healthcare very largely has been, I stumbled upon a molecule. Oh, there happens to be a therapeutic class of sickness for it. Well, let's make a gap, right? We really haven't studied the demand side of sickness enough, or prevention enough. But with things like wearables and being able to sequence the human genome and being able to use quantum cascading lasers and mid-IR type spectrum microscopy to be able to evidence the demand side of the business better, we're going to find things that are wrong with the human condition that we will then go look for brands for, as opposed to finding brands like many people would laugh and debate that restless leg syndrome was made up, right? Because someone found a drug that could do that. Hey guys, I'm at 1%. I was wondering whether we should close off sort of a little bit more smoothly than me passing out virtually.
Okay, then let's close off. Offer the audience a piece of advice for organizations who want to undertake a digital transformation. What are some of the key challenges that you have seen, and how do you overcome them? And you can talk as fast as you want to get the information in before your battery dies.
Yeah, I think it's about operating corridor, right? So you really need to get a buy-in at the executive level that we do not believe that the model that we have today is going to withstand 40, 50, 60 years, right? I think you have to find the operating corridor there, and it starts with a CEO that has the foresight. Most of the CEOs that have the foresight are able to push back on a board and stakeholders that says, yeah, you know what, your quarterly results are not going to be amazing the next 3 quarters, and they're going to be a little bit less than amazing, but I can tell you that we'll be around for 30, 40, 50 years, as opposed to I'm going to get you really good quarterly results in the next 3, 4 quarters, but I'm not sure that 20 years from now we have a strategy. I think when you can find that operating corridor, you're going to be a CDO that's going to have fun. If you don't have that operating corridor, you're going to have a difficult time. And it's about, we live in a tact of quarterly performance, and if you look at that tact and the pressures of Wall Street, very unlikely that you're going to have a 20-year strategy.
Richie, thank you very much for dropping all that science on us in the last 42 minutes. Really glad to connect with you on our show, and look forward to writing a summary of your thought leadership, and appreciate you being on the show.
Hey man, listen,
Okay, and just as his battery died.
Michael, I think he was going to say, you guys are really smart, love your show, and I hope I can come back. I think that's what he was going to say.
Oh, that's definitely, absolutely, Vala, that is definitely what he was going to say. So we have been talking about the Chief Digital Officer role and digital transformation with some intersections into healthcare on episode number 110 of CXOTalk. I am Michael Krigsman with my gloriously fabulous co-host, Vala Afshar. And Vala, I hope that your weekend is full of innovation and digital transformation.
And disruption.
And
No,
disruption.
I don't want disruption. And I don't want to transform my weekend either. But I do want to know, who's our guest next week? Because I believe you have a pretty extraordinary guest.
Our guest next week is Tim O'Reilly.
Tim O'Reilly of O'Reilly Media. Fantastic. Hope that you guys that are watching will tune in. We have a very, very extraordinary guest, not unlike any of our previous guests next week. So
all of our guests are amazing. And I'd like to ask everybody, before you go, would you please sign up for our mailing list, because we'd like to know who you are. And we'd like to give you special things that you're going to find useful and compelling.
Terrific.
Okay. See you next time, everybody. Thank you for joining.
Thanks.
Bye-bye.